Today our topic is about antisepsis. But before we get into the antisepsis, we will see how doctor deal with asepsis conditions. Here we saw the assistant brought the sterilized metallic chamber to the dressing room. Then the doctor is do the scrubbing procedure with the 70% alcohol solution. Then he asks assistants to open the metallic chamber. Then he wears the sterilized gown. Next he moves into the putting gloves. Next he arranges the sterilized table for further procedures. Here we can see he is arranging the tools which are taken out from the dry heat oven. Also he arranged the wound dressing materials which are already sterilized. Next doctor will prepare a soaked wound dressing material by H2O2 or alcohol solution. Then he will hand it over to the nurse and ask her to keep pressure on the wound. While she is applying pressure on the wound, she will perform dry moist shaving as shown around the wound. Next procedure is called prepping. Doctor is cleaning around the wound as much as possible by alcohol soaked wound dressing. After procedure prepping, doctor will do the next procedure called draping. In this procedure, doctor will cover all the body of the patient except the wound area. So from here, process of asepsis is over. Now we are ready for the antisepsis. First process we do is irrigating. Here the nurse drops the sterilized syringe on a sterilized table. Then the doctor will take it from the table. With the help of the assistant, the draining solution will be filled into the syringe. For this we can use furous solution, hexachlorophene, chloroxidine or boric acid as solutions. Here we can see the irrigation process, and it should be done in high pressure. Irrigation comes under physical antisepsis. Next we will move on to the mechanical antisepsis. Here we gonna cut the edges of wound which are necrotized, and before that we can use any anesthetic liquid or injection for reduce the pain for the patient. Here the doctor will first dry out the wound. Then he will start cutting the necrotized tissues. Another physical antisepsis method is draining. So as you can see in the picture, we will put a special plastic tube inside the wound, and at the other end we will use a plastic bottle which we gonna squeeze and make negative pressure in that. So the fluid inside the wound will be come out through the plastic tube. Next is biological antisepsis method. Here we are applying antibiotics to the patient. So it can be intravenous, intramuscular, or another method of injections.